impact of COVID-19 on efforts to end FGM. And this is what I will do today. So I will share with you the input that I received on how COVID-19 is impacting your work on ending FGM. I would like to really thank all of you who sent me emails, who shared with you experiences via WhatsApp, but also those who were willing to have a Zoom call in the past 2 weeks to really share with me how COVID-19 is impacting your work. So thank you so much for doing that. And I'm very excited, of course, to share all the information and all the stories that I documented with you during the webinar today. I will also reflect a few moments on COVID-19 and Ebola and zoom in. Today we will zoom into the situation in Kenya. Maybe it's also good to go back a bit. So this is the outline of today's webinar. So I will start with my presentation. Then Rhobi will share with us, give us an update on what happened the past 2 weeks since our last webinar. Then Agnes Pareo will be sharing her experiences related to the impact of COVID-19 on ending FGM in Kenya. And then Margaret will share with us the challenges they face, the risks, and also some good practices on how in these crazy, hectic times of the pandemic, we can still continue with our work towards ending FGM. So we have a very full schedule, but please bear with us. If you have any questions, please introduce yourself now in the chat. If you have any questions, feel free to use also the raise your hand button. We would like to make this webinar interactive, so also please pose any questions that you might have in the chat. We will also have some polls because I want to know whether what I'm sharing with you corresponds with your experiences as well. So I'm very excited to start. Now, a few remarks to start with. There is more and more evidence that an increased number of girls are at risk of FGM in Africa. So I think all of you have seen the reports and the new research of UNFPA, in which the technical note says, due to the pandemic-related disruptions in prevention programs, 2 million FGM cases could occur over the next decade that would otherwise have been averted. Now, I also noticed on Twitter this post of Peter Kamai, and he shared on Twitter this post stating, we have info that 3 girls were subjected to FGM yesterday in Chetram, West Pokot country. No arrests made so far. Fellow Kenyans, as we stay at home to stop the spread of COVID-19, many girls are being mutilated with no help. And a few days later, he also shared this newspaper article. So I don't know, Peter Kamai, are you in the call now? And if so, could you please unmute yourself and maybe reflect on those cases of the 3 girls that were subjected to FGM last week?
I can't see him on the call.
Okay, well, I emailed with him and he said that he might be here, so I thought I will ask. But if not, those are some worrying trends from Kenya. So we have the UNFPA technical note that says that we have 2 million extra or girls that are not protected. We have those anecdotal evidence from Kenya. But then also a lady from Nigeria shared with me that COVID-19 has increased the number of girls got in many rural communities in Enugu State, Nigeria. So over the past 2 weeks, a lot of worrying trends were shared. And I think that is quite disturbing. Now, a second remark is that there is a real threat to the progress that we have achieved in the past decade. So one of the members of civil society shared with me, I'm afraid we will go 10 steps backwards to what we have achieved. So quite some people that I spoke to are really worried. I think I do share those concerns, listening to all the stories while I'm documenting all the stories from the ground. Now, I also would like to share with you this short video, because I think it's important to also listen to the voices of young girls. So this is a video that was posted on Twitter. I hope it is going to work, but I'm going to try to share this with you.
Assalamu alaikum. My name is Mariam Ayan. I'm 12 years old and I'm not cut. Due to COVID-19, schools have been closed. Girls of my age are at risk of being cut. And FGM prevent corona. Thank you. Assalamu alaikum. My name is...
And this post was shared by Sadia Hussain. Sadia, are you on the call? If so, could you please unmute yourself? Janet, can you see whether Sadia Hussain is on the call?
Yes, I think she is. I've unmuted, Sadia, I've unmuted you.
So Sadia, could you please share with us the story of this girl? And I completely agree with you that we should share the voices of young girls. And could you share with us, the people who are present in the webinar, a bit more background about why you posted this compelling movie of the girl?
Okay, as we all know, girls are, yes, at risk of being cut because FGM used to happen during school holidays. And now because of COVID-19, we now have a long holiday more than ever. So FGM is happening, and okay, as we know that girls are always innocent. Like for my case, when I was being cut, I never knew FGM was a bad thing. And that's why parents take advantage of girls with their innocence. Nobody knows what the pain is, and you will endure for the rest of your life the pain you went through, and you will start regretting after the cut. So nobody prepares these girls for the pain that's awaiting them. And we all know during this pandemic, 3 issues are happening. Number one, the schools have been closed and girls are at home. Number two, everyone else is prioritizing to fight the coronavirus, the COVID-19. So there is less attention when it comes to preventing FGM. Number three, now because of now the attention that has been diverted, communities feel that this is the right time they can now use to cut girls. Thank you.
Well, thank you very much, Sadia, and thank you also for sharing this this important video, because it also reminds us that we are, you know, organizing webinars. We talk about ending FGM, but in the end, we're talking about girls like Mariam that are currently at risk of the practice. So those were a few remarks to start with. Now I would like to share the input that I received from you. So this is a slide that I shared with you during the previous webinar. I invited you to share with me how COVID-19 is impacting your work. And I had 4 questions: the potential risks, the opportunities, the challenges that you are facing, and also possible solutions. And I combined the answers that you all sent to me in the past 2 weeks with existing information, for example, the technical notes of UNICEF, UNFPA, briefings that have been published, research that has been done. And I came to the following conclusions. So first, the potential risks. As Sadia also said, and as also Rhobi said during the previous webinar, the schools are closed and girls are staying at home. So this is really the #1 risk that all of you shared with me. Girls are often cut, as we know, during the school holidays. I hear from campaigners on the ground in Tanzania, but also Kenya and other places, that the cutting seasons are extended due to COVID-19, and that is really a big risk. Then the social distancing, of course, as we can imagine, that is restricting a girl's mobility, and also a girl's social isolation. That's also something I mentioned during the previous webinar, and this was confirmed by many of you. Now, the loss of social support, loss of protection networks, the lack of privacy is also mentioned by many of you, and also that the cutting has gone underground, or that it can happen unnoticed. So one of you sent me a quote stating, "You can be cut in the house and no one knows in times of COVID-19. So this is really a true potential risk. Now, of course, something we also mentioned before is the restricted access to health and SRHR services due to COVID-19. Now, there are also some opportunities. So some of you mentioned that the cutting ceremonies that were planned are postponed. Some of you really sad to see an opportunity in the case that you could include FGM in the broader COVID-19 messaging. And some of you also mentioned that there is a reduced medicalization of FGM. So that is a consequence of the COVID-19, but not so many opportunities here. However, there are quite a lot of challenges that you shared with me. Now, first of all, you as campaigners, as civil society organizations, are disrupted from your important work. So that is the #1 challenge. So due to the lockdown, you cannot go to the field, you cannot do the outreach activities that you usually do in order to change the hearts and minds of people. Now, another challenge that many of you mentioned is that there is no or limited law enforcement. So law enforcement institutions, some of them are open but have only limited capacity. In other countries, they are already closed. So the protection provided to girls at risk is very limited. And one of you shared with me the following: the child protection officer in our village is not at work. The institutions are closed. Where do we need to go to? How can we protect girls at risk? And this is really an important challenge that we need to take care of. Now, another very worrying trend is that I've noticed that safe houses in Kenya are closed. So girls are sent back to their families because in a safe house, you have many girls who are coming together, and due to some legal measures of the government that I will dive into in a minute, it resulted in the fact that many girls were sent back to their parents, which means, of course, as you can imagine, an increased risk of FGM, child marriage, and other forms of violence. Another challenge that you mentioned are that businesses and markets are closed. Now, why is that a challenge? Well, first of all, parents do face economic difficulties. And in case of economic despair, we see that parents are marrying off their daughters. And of course, as we know, FGM is a precondition to get married. So this results in an increase in FGM. However, another part of the same coin is that cutters who were re-educated, as Rhobi also mentioned during the previous webinar, they have their small business, but their businesses are now closed, and there is a risk that they might go back to cutting. A last challenge that was mentioned by you is the drop in funding. So many NGOs already face a huge drop in funding, for example, because of the lack of tourism, but also because of other reasons. And this has been highlighted by you as a real challenge. Now, what are possible solutions? Well, first of all, to provide a hotline in case there is none, or when there is a hotline, to strengthen the hotline for those at risk. I've spoken to quite some people in the past 2 weeks, and this really came up as a very important factor. So one of you said, hotlines are becoming more and more important. It is the only link to the outside world. And I think that is really the case, and we should really focus on that. Now, another solution, if you cannot go to the community, is to do community outreach via the radio, via social media, and also via the TV. And I'm very happy and excited that COVAW is willing to share with us more in-depth experiences and good practices in that regard. Another solution is, for the lack of funding, that especially at times of crisis, at times of this global pandemic, extra funding for civil society organizations is needed. Now, I also would like to reflect very shortly on COVID-19 and Ebola. So last webinar, I made the comparison between Ebola and COVID-19, and I looked at possible opportunities. Now, very short, for those who were not present during our first webinar, during times of Ebola, FGM was interrupted. So in West African countries, child marriage during Ebola increased, but FGM almost stopped. So what happened was that girls were married off without undergoing FGM. So this is something in a normal situation we would think is impossible. However, during the times of Ebola, this is what was happening. However, FGM resumed after the end of the pandemic. So people were really scared for the Ebola virus to spread. But when the Ebola virus was out of the country, people continued practicing FGM again. Now, if we now look at the first anecdotal evidence, the first findings, research that we have on COVID-19, we do see an increase in FGM. So it seems that parents do see an opportunity now and take advantage of COVID-19, the current situation. And that made me think in the last 2 weeks, because what can we learn from that? Well, there are two answers to that question. The first answer is that we haven't been successful in changing the hearts and minds of practicing communities. It's not a very nice thing to hear, but if people go back to cutting after Ebola, it means that they are convinced that cutting girls is the way forward. Otherwise, they would have stopped practicing FGM also after the Ebola crisis. Now, another option would be that we have been successful in changing the hearts and minds of practicing communities, but that the social pressure is too high, so that there is no other choice, so that, you know, people they are convinced that FGM is not a good thing, but they have no other option. There's too much pressure, there are economic needs, or any other reason. And I think it's important also from a more fundamental, from a more long-term strategy point of view, like, what are we doing? What are our tactics? How are we generating the change that we want to see in the future? And also relates to the sustainability of our end FGM effort. So this is a huge question. It's a big question, but I want to also, you know, after reflecting on what I shared with you during the very first webinar, this is something I think we need to think about, and to have a debate, a discussion among ourselves about what we think should be done, how we explain the different reactions related to COVID-19 and Ebola, and, you know, make a change in the future. And I would love to hear your thoughts about that as well. So please feel free to also share in the chat how you see this situation. Now, quickly, I will move to the situation in Kenya. So last webinar, we discussed the situation in Tanzania. Now I would like to focus on Kenya. And the reason is that I saw those two tweets that were very worrying about, you know, the 3 girls that were cut, and that Men and FGM shared on Twitter, also the newspaper articles, but then also something else really shocked me that I would like to share with you. Now, first of all, we all know that President Kenyatta said during the ICPD 25 that I attended, so this is my picture, and I know many of you were there with me, that he said that he's committed to end FGM by 2022. If we look at the COVID-19 situation in Kenya, I've been informed that the schools are closed, that public gatherings are banned, and that there is restricted movement, like we also see in Europe. Now, what is very worrying is that the Kenyan government has adopted two directives, two circulars. And the first one was adopted at the 18th of March. And it's a presidential directive that informs safe houses, among others, to release the children and to send them back to their families. And there is a second one of the 31st of March that forces safe houses to really report the details and also the amount of children, the amount of girls that are released or sent back to their families, to the government and to local authorities. And as you can imagine, this is a really worrying development. So what will happen most probably is that those girls who go back to their families will face the risk of undergoing FGM, face the risk of forced marriage and also other forms of violence. Most of the girls live in remote areas. They have no access to internet. They have no mobile phone. There's no way that they can seek help. So most girls also come from a background of high poverty. And also, apart from the risk of FGM and child marriage, which is our focus of our webinar, you can imagine that they also face the risk of being subjected to child labor or child trafficking in times of COVID-19. So this is a real fear I have, and I would also invite the other two speakers to reflect on that, because I'm quite worried about that development. Now, what is my conclusion? My conclusion is that the sentence, stay home, stay safe, that doesn't apply to girls at risk for FGM. We need to really focus on the threats that we currently face during COVID-19. Also, because many of you shared with me that they are worried that all the achievements so far are under threat. And as I also shared the quote, we don't want to go 10 steps backward at this point in time. So it's really important that good steps are being taken. Now, what I also noticed, and I shared that also during the first webinar when I was sharing the first documents of UN agencies that were mostly focusing on violence against women, mostly focusing on domestic violence. So what you really see is that there is less attention for FGM during COVID-19, but we know that it's so important to really focus on the risk that girls currently face. So I would recommend that FGM must be at the center of all plans on COVID-19 response. And also this was one of the key messages of the donor working group on Tuesday. We need to mainstream FGM in COVID-19 response. And I do fully agree with that. And my last point, as we know, COVID-19 is a very new virus. There's not much research yet. There's not much research also on the impact of COVID-19 on FGM, on our work. I'm doing my best to document everything I share. I will share all the information that I gather with you, but I really would like to ask you to work together. Let's do this together. Let's share information, experience, and knowledge. Thank you so much. Back to you, Janet.
Oh, thank you so much, Annemarie. So I think we'll go straight on to Rhobi to give us an update of what's been happening at safe houses in Tanzania. So Rhobi, if you can unmute yourself. If people have got questions for Annemarie, please start writing them in the chat and we will come to them later on. Thank you. Rhobi, are you there?
Yes, I'm here, Janet. Thank you, everyone. Can you hear me?
Yes.
Yes.
Okay.
Thank you.
Okay. Thank you, Annemarie, for a good presentation. I'm Rhobi from Hope for Girls and Women in Tanzania. I would like to share with you about updates from Hope since the last webinar. In Serengeti, we have one confirmed case on COVID-19, and this has made us as Hope to take an action in order to reduce the risks to our safe house. We have stopped some of our staff who are coming from outside, and we have planned for a good quarantine for new arrivals who are coming to the safe house. And yeah, for now, I can say in terms of accommodation, 2 girls are sharing each mattress. Another thing which we are doing is creating awareness to the community, where we are working in collaboration with the Serengeti District Council and the Grummet Fund to create awareness to the community about the effects of COVID-19 and on how insisting the community how to wash their hands and also putting the social distance upon them. So we are using also this advertising, using loudspeakers in order to take the message to the community. We are continuing with the prosecutions where we have 5 prosecutions cases continue to the court of the families who cut their daughters, but also 1 man sentenced for 30 years today because of the raping case. And the girl is protected to the safe house. Yeah. On the side of education, due to the increased number of the girls to the safe house, it leads to difficult education, providing education to the girls at the safe house. As we know, all schools are closed now, but we are trying to do what we can do. Like for the girls who are learning vocational skills, tailoring skills, they're making masks for the girls to use, but also some for sale. Also, we have through video conferencing, we have girls who are schooling secondary school, accessing these English lessons through this lady Mina from UK. Yeah, but also I can say through digital champions, we are continuing to receive information from the community, the updates, what is going on to the community. But also these digital champions are collecting information about risk factors for research projects. We have our film called In the Name of Your Daughter, where it was shortlisted for 1 World Media Awards. And also through this film, we are continuing to create awareness to the community, especially for focal clubs are using this film, to create awareness in their community there and support people to know and raise maybe raising funds to support Hope work. Thank you very much for listening, and thank you very much, Annemarie. You have taken us in some solutions which we could take for us to use. I can say for now, I can see, although we have the FGM cases continue to the community, and we are continuing to receive the new girls whom we guarantee them until the doctors allowed them to be mixed with other girls. So, and thank you very much for everyone. You are warmly welcome if there are some questions.
Thank you so much, Rhobi. And if people have got questions for Rhobi, please do type them in the chat and we'll come to all the questions at the end. So I'd like to pass straight on to, is it Agnes or next, Annemarie?
Yes, Agnes may go first, but Agnes doesn't have a PowerPoint presentation, which is perfectly fine. But that's why you see the COVAW presentation already.
Okay, so Agnes, if you'd like to unmute yourself and start, you're very welcome. Right, Agnes, I've unmuted you so you can start speaking. Are you there, Agnes? Can you hear us? If Agnes isn't ready, maybe we should go on to Margaret and come back.
Oh, yes, maybe I can go.
Yes, thank you.
Yeah, thank you very much, everyone. And thank you, Annemarie.
Thank you, Annemarie.
Yeah, I would like to go straight away. And as the situation is, as COVAW, Coalition on Violence Against Women, our work is also interrupted. And straight away, maybe to let you know that much of our advocacy work, much of our campaign to end FGC, we are doing it in Narok County, a county that has a total population of 1,157,873 people. And in this particular county, there are diversity of tribes, but the main or major tribes here are the Maasai and the Kalenjin community, who are nomads. And in these two communities, female genital cutting is a practice, a cultural practice that is deeply rooted in their culture. And the statistics showing that FGC or FGM is actually at 78% compared to the nationwide 21%. Can go next. Yeah, actually, if, I would share briefly some of the predisposing factors is that the practice is happening in secrecy. The current stay-at-home order provides a very fertile environment, or maybe fertile ground for the perpetrators of gender-based violence. And in this particular regard, female genital cut. There are issues around economy. Most of the families here are very poor. This one triggers early child marriage. And another challenge is that, or another predisposing factor is the accountability mechanisms are actually now shifting more to the academic as opposed to addressing social issues, where female genital cutting is one of them. Yeah. Can go next. So some of the key challenges that we have highlighted is that initially we've been engaging the community through community dialogues, outreach meetings, also having meetings with both state and non-state actors that we engage in our work. And this one is not happening as a result of the social distancing directive. And also at the community level, I would say, there are other challenges that the community face, lack of access to very basic needs like running water. That's quite a challenge, and this one affects our direct beneficiaries, women and girls. And more especially now with the spread of coronavirus, it's a real-time challenge. Proceed the next, yeah, sure. Some of the key risks that we are looking at the moment is actually that the key informants from the ground, the people we work with, including the community activists, information has it that in some parts of Narok, the circumcision for the boy child is going on. This is quite unusual. It normally happens during the December holidays. And this one is an alert that probably even cutting of the girls could be taking place, but in secrecy. Another challenge is that access to essential health services are hampered. Actually, since immediately the pronouncement of COVID-19 happened, most of the dispensaries at the village level were closed. And on top of that, currently the county is facing adverse weather conditions. There are floods all over. The road network is very, very bad, meaning that access to the essential services is a problem. As we are aware, most of the parts, internet is a problem. Online connection or communication is not easy, and even the roads now are impassable. That's quite a risk, and especially affecting people like pregnant women who could be seeking health services, girls who might be running away from the perpetrators. Even now, using physical means to run away is not possible because of the situation on the ground. And also, as it is, this lockdown is so providing favorable condition probably for risky behaviors that teenagers and let's talk of the youth might be engaging in, and this can be contributing to the rising cases of teenage pregnancy, which is recorded at 40% in this particular county, Narok County. Yeah, proceed the next. So yeah, as an organization, it was quite worrying that as it happened, everything came to a halt. We were now immediately advised to be working from home, given the government directive on social distancing. And so quickly, we thought that we had to have a means or a way to be able to carry on working in as far as we can, as much as the direct operations of the ground were affected. And in so doing, we have opted to using the online meeting platforms as staff, and also engaging other players in gender-based issues and advocacy. And through these meetings, we are able to share communication and even realities and experiences of what is happening on the ground from other like-minded civil society organizations, and even as well as through the networks we engage from the state actors. We are able to get updates of what is happening, and through those platforms of these meetings, we're able to pass the information and share strategies of the best way forward, so the discussions are going on. Apart from that, also, as COVAW, one means that we've identified that is helping us adopt very fast and continue the conversation or advocacy and on the Female Genital Cut campaign is through the use of radio shows. And we have been able to have in the past few days two radio shows. In one radio station by the name MOFM that targets the Kalenjin speakers, and also Sidai FM targeting the mass speakers. And I hope some of the discussions we've been having are topics around prevention of FGC, the emerging trends of FGC during the lockdown, the myths and conceptions, myths on sustaining female genital cut among these two communities. And I would say from these engagements, the discussions have been very productive and quite engaging. From a few reactions, I've maybe I could mention but a few. Yeah, we could see like one response from Chief by the name Madam Chief Sialo from Narosra, who was very appreciating that the fact that COVAW is still able to take up this conversation. COVID-19 could have diverted the attention as it's taken the community by storm, but the fact that we are engaging them means that now gender-based violence that could go unnoticed now can be addressed. And she was like, thanks for informing us, everyone to be on the lookout. And also this reaction or response on the practice has shifted. It is done secretly, and at times a girl could demand it herself from one girl, Nasirian, Sidai FM. Another one was, yes, following the program, I joined hands to oppose FGM, but how can we continue the lessons that girls learn during the cutting process? And from these responses and reactions, we learned that, yeah, a few individuals, some of the community members are recognizing that, yes, the cut is wrong, it's against the human rights. And in such a reactions is a clear indication there is need for an alternative rite of passage to continue conveying important lessons that girls go through. So during these conversations on radio, we have been able to pass very strong messages, like one from the gender director, Narok County, that she clearly stated to the listeners that the Kenya Anti-FGM Law 2011 is very clear. Anyone found violating it will face the consequences. And she also reminded the community that the lockdown is no time for cutting girls, called them to make home safe for the girls, and also support by supervising the learning while at home, counsel the adolescents and especially the youth to avoid risky behaviors to ensure that children continue with school even after the COVID-19. A very strong and powerful message. Another one was from one of our community activists who indicated like it's really hurting to the fact that the cut is against the human rights, and human rights are girls' rights, are women's rights, and it being done in secrecy is very wrong. And he rallied the community, more especially men, to take the front lead in fighting the cut. The next one, please. Yeah, so another very strong message to the community is a reminder from Stella Sombet, a sexual reproductive health officer, who indicated that the cut has a far-reaching effect on the girl's health, to mention but a few: excessive bleeding, severe pain, and injury on the tissues of the girl's genitalia. No to the cut now and after COVID-19. So these strong messages conveyed to the community through via radio, and is the means or a way through which you've been able to engage the community, to keep the conversation going, to pass the message that there's need to collaborate, to work together to end the cut. Yeah. So actually through the media, much through the radio show that we've held, and even on our Twitter handle, we've been able to share the hotlines. Like as COVAW, we have a toll-free number, and we are receiving quite a number of calls from the community. I've also been able to share the government hotlines on gender-based violence as a means to keep the conversation going, encouraging the community to speak up, encouraging the victims to report so that they can be given a guidance, advice, referral pathways, and what needs to be done in as far as protecting themselves from gender-based violence, and in this regard, female genital cut is concerned. So thank you very much. Any question, I'll gladly answer.
Thank you so much, Margaret. That was fantastic. Agnes, are you able to speak now?
Can you hear me?
Yes, thank you.
Hello? Thank you. Can you hear me?
Yes.
Hello? Yes, because I was trying to talk, but because of my network, I'm sorry I was not able to, you were not able to hear me. And are you hearing me? Hello?
Yes, now I can hear.
Hello?
Yes, we can hear you.
Then I want to say I'm happy. Yeah? I'm happy to have this opportunity to speak about how COVID-19 have really impacted on our work. And I want to start by saying Kenya have made strides towards elimination of female genital mutilation and child marriage. However, this good progress has been heavily impacted by the current COVID-19 pandemic. We all know that the president has made his commitment to end female genital mutilation by 2022. And as anti-FGM board, we have been working well with the administration, and all these issues like one that we saw from the West Pokot, we talked to the chiefs, we also talked to the county commissioners who take action to the perpetrators of these young girls. And I want to say that what we are feeling now as activists, we see that these have really impacted on our work. Because female genital mutilation means changing people's attitudes towards what they have been used to doing. Then it needs a lot of field work where you go and talk to them, tell them that FGM is harmful, and why it is harmful and the need for them to stop. But because of this COVID-19, we are not able to go and talk to these people as we used to do. And as Tasaru, we run a rescue center that is still operating. We still have our girls here with us. We have about 77 girls that we pay school fees for. And since the curfew and the schools closed, the girls have been here with us. And we take care of them, and we make sure that they continue with their education. And what we are doing, because we cannot go to the field because of the pandemic, we try to talk. We have resource persons from the areas, from different areas. And these resource persons have been trained to monitor what is happening in the ground and inform us so that we can inform the police or inform the people who can take actions. And at the moment, we had about one girl, a case in Narok of FGM, and it was reported to the OCS, and the case is now in court. That is an FGM case. We also had the one that was rescued, and when the girl was brought to us, we have to advise the police for the girl to go for a quarantine, because there was no way we could bring the girl to the center for fear of her coming to the other girls and didn't know her status. So at the moment, we don't receive girls, but we have girls at the centers. And the grassroots organization have noted increase.
I think we've lost you, Agnes. Anne-Marie, can you hear her anymore?
No, I can't.
Okay, so we're running out of time anyway, so I'd like to invite people again if they would like to ask any questions. There's an interesting comment from Marnaz about real-time data. Marnaz, I don't know if you want to speak to this briefly. Great. Do you want to unmute yourself then? Thank you.
I think, oh.
Can you hear me?
I did unmute. Thank you. Good morning, everyone, or good day, everybody, wherever we are. So we collect the data in real time. And what do I mean by that? We are doing working in Kuria in Western Kenya, and we have 1,000 girls in 10 schools and several community field workers that we have trained. They use the technology, the bundling of technology that has education pieces to it, as well as bringing awareness and then documenting that those things are happening, but also interviewing the girls at the beginning of the school year. We interviewed them, and we had real data. We had 87% of the girls we have interviewed, probably 1/3 of the population by the time we were having community meeting. And we have interviewed 1/3 of them. From that 1/3, over 87% of them said that they are fearful that they will be cut in the cutting season, being November through December of 2019. So we took that information, of course, without names, we took that information to the community meeting, and we confronted the people in that group into, if a foreigner can come in and in 36 hours come up with this data, how could you say that it's not happening here? Or how could you say that it's illegal? We know all of that, but it's happening. Look at the fear in the girls. So we basically got 70-some members of the community, tribal and religious leaders, and everybody that was in that meeting. They signed declaration and they became advocate for the cause. So they have gone around as we bring the families and parents to the meetings to talk to them about the harms of FGM. Many of these community leaders, whether it's the child services person, whether it's the chief of police, whether it was the sexual and reproductive health person from the Ministry of Health, they all have come and have spoken in these groups too on behalf of the project. And then we continue working with the girls and boys at the school to teach them about the harms, the legal aspect of it, the social aspect of it, and so on. And as we reached and we did the second round of interviewing before COVID hit. And in that set, we basically now have 1,000 girls, and from the 1,000, over 50% were no longer fearful of being cut, because they thought that they have self-esteem, they thought that they can convince their parents, and all fail, they knew what to do after that, whether it's a hotline, and then we actually ended up rescuing 36 girls, 20 of them within the cohort that we were working with, and the others outside of that in the cutting season, because we were so connected to the community on the ground, and we were able to really get the chief of police actually, and then the Ministry of Health put an ordinance out that the parents must bring their kids back. We provided for transportation for them to come back. So there was a lot of activities that we did to do that. And unfortunately, because of the COVID right now, as the girls are going to be interviewed for the third time, we can't do that easily. The caseworkers are doing it door-to-door per se, individual girls, but I think the mapping that Janet, you talked about would be very helpful, because we don't know in that part that necessarily where everybody lives. So out of 1,000, we probably have interviewed for the third time, maybe over 200, close to 300 of them, but not all of them. And that's due to COVID. And we're very, very much in touch with the folks that are on the ground and working, and they're assuring us that the girls are safe. They are continuously talking to the families, continuously keeping the community stakeholders really engaged, not letting these girls be cut.
Thank you very much. That's extremely interesting. I wondered how you were collecting the data.
So we basically we have a solar power backpack, we have a computer, and we have a platform. The platform is password protected, and the community field officers that we have trained how to use this bundling are the folks that are actually going to schools and meeting with the girls and interviewing them and interviewing. Yes.
Thank you. I mean, Rhobi is using ODK, Open Data Kit, which is a free app on phones, which works offline. I don't know if anybody else is using that, and we're very happy to share some information, because maybe it would be, if people are doing any sort of questionnaire or so on, perhaps they're willing to share them and we can all learn from each other. In the interest of time, there's another question. There's a question from Sadia about whether we can pull resources together and support activists, particularly around things about community awareness, masks, and so on. We at Tanzania Development Trust have been doing a lot of sharing of resources, particularly in Swahili. So I can share some links to those in the email that we'll send out. But if other people have got links to other resources, particularly in Swahili, then that would be really, really useful. And it would be interesting to know what's happening in Kenya. In Tanzania, where there's an initiative. I mean, Rhobi's been making masks, as she said, but we're also sharing links to 3D made visors for health workers and many other things. And it would be interesting to share those initiatives. We're also working with a group of doctors in the UK that are doing a lot of online training, particularly for doctors around COVID, and I can share the links of that as well. Rachel's just saying one of the biggest challenges is funding for grassroots activism. I don't know if anyone has any comments on that. And Stephanie is also going out into villages and so on. We've got about 2 minutes left properly, Annemarie. Do you want to say something and answer any of that?
Well, I saw that, let me see, also the ORCID project is using some, let me see where I have the, so maybe also ORCID has used ODK through ONA and has found it super helpful. So maybe Claude, you want to share very briefly how helpful it is to also inspire others?
Sure, yeah, happy to jump in briefly and lovely to connect with all of you. We have used ONA, which is a free platform for capturing data. We've used it in Somaliland and in Kenya as well. And then we found it very effective working with communities to build a survey that then gets stored onto a phone or a tablet. And then community researchers are supported to use multiple choice answers collected on a mobile phone that is all kind of then stored on this platform and more easily disaggregated and analyzed to kind of highlight learnings. So we've done a number of different research projects, which I'm happy to share with you, Annemarie, and then maybe as a follow-up, if you wanted to share those out with the group, happy to do that. But please, I'll pop my email into the chat now, and if anybody wants to connect on this, I'm happy to say more.
Yeah, please do.
Thank you.
Then I also have a question, like Janet, we have a bit more time if people find it interesting, because I scheduled the Zoom for an hour and a half. So if you want, please stay a bit longer. I also saw that my friend Tamari is here, and since we are talking about the situation in Kenya, Tamari, do you maybe want to share also some of your experiences related to COVID-19 in Kenya at the moment?
Thank you so much, Annemarie. I hope you can hear me well, everyone. Hi, everyone.
Yes, we can. Thank you.
Yeah, so some of the experience we are trying to have intervention strategies with the communities is because of the difficulty in reaching the communities. So what we are trying to do currently is to work with community health workers who can access the communities to build their capacities. So we have developed a platform where it is an online platform that these community health workers from wherever they are, through their phones, they can access, undergo some training, and then we build their capacity in terms of, while engaging the community around COVID, then they also send messages around FGM and child marriage. So this is one of the ways that we're thinking in terms of helping messages reach the communities despite the circumstances, working with already existing frameworks around the health systems. And who we have identified to work with is actually community health workers. Yeah, then there was just something I mentioned, because in terms of thinking about the surveillance for girls at risk, so the crowd mapping idea is very good, but I was wondering, so once we've identified these girls, what happens? Are there strategies or frameworks that are put in place or can be put in place if someone has had that experience, to see how to salvage these girls from undergoing FGM or child marriage under COVID circumstances? So that was the question I had put on the platform.
Yeah, thank you so much. Maybe Janet, you want to quickly react to that, to the mapping?
Sure. Well, so we've been working for the last 4 years to help activists like Rhobi have maps of their areas so that they can better find and protect the girls at risk. Because before we started, the area of Serengeti was, you had villages of 10,000 people that were not on any map. So typically they would Rhobi would have a phone call in the middle of the night saying girls are about to be cut here. There's no road signs, there's no maps. So it's very difficult to find them quickly. So since then we've recruited about 14,000 online volunteers that are mapping from satellite images. And we're also training people on the ground to add points of information such as churches, shops, police stations, etc. And then we're training people to use a free smartphone app called Maps.me, which works offline, that you can use for navigation. So if you know that the girls are at the pastor's house in this village, then you can use Maps.me to navigate to it quickly. So it's very good for helping you find specific places. Obviously, it doesn't solve everything. You still got to work out what you're going to do with those girls. But I think, I mean, I don't know if Rhobi wants to say any more about this, but you know, mapping is very helpful for navigation and also for doing analysis of where the girls come from, you know, the best way to get there, particularly in different seasons, etc. Rhobi, do you want to add anything? But if there's more information on this on Crowd to Map, I've put my email in the chat. I'm very happy to talk through it more. I mean, this is a volunteer effort, so it's basically cost pretty much nothing. And this method can be used anywhere. So it's all open source, and I'm very happy to help other people if they're interested. Rhobi?
Thank you, Janet. I think you have explained everything well, but using mapping our areas has helped us a lot to rescue the girls in our villages, because we have mapped even the safe places where girls could be protected while waiting for the rescue from the police gender desk and we as Hope. So I can say mapping the areas is helping in fighting against the FGM. Not only that, but also mapping is helping you in planning, because you know how long will take from where you are to that village, and how many kilometers, how much fuel. So mapping the area is helping a lot, I can say. But also is helping us to know which villages they have high prevalence of FGM. Thank you.
Thank you, Rhobi.
Thank you. I also would like to ask Jeremiah Kipanoi, who is the man behind the podcast on FGM, to also share with us perhaps your perception and your view on the presentations that were given today, and also perhaps announce that you also have a very good initiative to share stories from the field with a larger audience live via Twitter. So I don't know if you are still there, Jeremiah?
Yes, and I'm still here. Forgive me, you might not be able to see me because of the device that I'm using, but I'm very happy to be here today. Yes, they were very excited. There was so much insight in what I have listened to today. Thank you very much for sharing this platform with us all. At this time, we just realized that most of the people find themselves working from home. And one challenge that people are facing is the inability to respond to cases immediately. People are running back home during curfew hours. So that's a challenge that I have heard from different people. So lots of insight coming in. I really do not have very specific measures that I would say should be or have been taken here right now just to make things better on a larger Kenyan scale. But yeah, we are still trying to adjust slowly, and people still coming together. More and more partnerships happening. Lots of Zoom calls are actually happening. So I think as time goes by, we'll be able to address them well.
Yeah.
Yes.
So could you perhaps, because Peter Kamai unfortunately was not in the call today, but I mentioned his Twitter post in my presentation about the 3 girls that were subjected to FGM in West Pokot country. Could you provide an update on the situation of the 3 girls? Because I know you have been discussing it yesterday as well, right? In the webinar.
Yeah, we've been having discussions with activists from Pokot. The day before yesterday, we were actually doing that. I haven't followed up on that specific case, but we'll actually follow up on that after this. Probably will, if there is an avenue where we could share feedback, then I think I'd be able to give much more accurate. What I know is that the activists on the ground were still following it up. Even Domtila was doing it. So I haven't really followed up on how far they are because, as you had said, I'm trying to also follow up on Kajiado now. Yeah. So that's where we are at.
But is your your feeling, having all these stories from the field from so many different activists lately, is your feeling as well that the number of girls increase in terms of FGM?
Yes, I think as time goes by, communities now realize that maybe schools will not be opened before. Maybe it might not be opened very soon, because normally sometimes you have during the April breaks where girls are even cut during that time, you have just a short period, but they are still cut. Now, this was not a planned holiday, so the parents didn't, or even the community didn't have lots of time to plan. But I think, and I see now cases coming up and rising every day as girls keep on staying at home. So I think with time, if interventions are not taken, then I think there will be more and more cases. But one thing that I realized is with the trends, some communities, for example, the Kuria in the southwest, actually bordering Tanzania, the activists there were saying there are not many cases because they mostly do the cut in frequencies like after 2 years. So I do not know how that would actually be affected by COVID-19 because I know that they normally do it en masse. But we've had cases like the show we had yesterday live was in Samburu, and we had AMREF and also Samburu Girls Foundation also talking about cases that are rising in Samburu. So as time goes by, trends keep on changing. So we just, I think the best way to go around them is find a way to make them more predictable than know how to work around them.
Well, thank you. Thank you so much for sharing. That's very interesting.
Thank you very much.
Well, I don't know, are there any other very pressing questions or things you might want to share? I saw a comment of Sadia who says, can I say something useful briefly? Of course you can, Sadia, please go ahead.
Can you hear me?
Yes, we can.
Okay, thank you once again. I'm Sadia from Tana River, Kenya. And this is just something I wanted to say briefly. Okay, right now we know that there is the issue of social distancing and there is no public gatherings. So the stay at home issue. So as activists, we would want to go to the grassroots and also collect the information of girls. But the pressing question is, how are we going to help these girls? You know that before they cut, you can do something to protect the life and the dignity of this girl child. But after they cut, what happens? There is the trauma of now the regrets after the cut and all that. Okay, you reported. Once the reports are done, the biggest challenge I always face is now they want to take also the girls along for as an evidence or witness. So how do we go about this? This girl is already cut, taking her to the police station as a witness. Are you helping her or you are further traumatizing her? This is something that has been really disturbing me. Okay, another issue is that now, how can we support these now grassroots activists to actually go to these villages, now educate the communities about COVID-19? Because some communities are very stubborn. The way they are with the FGM issues is the same thing with the COVID-19. Now they don't even believe there is COVID-19 because they think it's just a normal flu. How can we now empower these grassroots activists to actually go and do the reporting? With the global media campaign, they have empowered graduates on how to use their smartphones to record stories and case studies. So how do we empower these grassroots activists to do the same? The one and last question is about, like for my community, FGM stands at 94%. We had the issue of FGM being alluded to religion and my community practicing FGM as a religious requirement. Now, I don't see any religious leader here joining us today. Can we have religious leaders also joining us, telling us what is also their stand against FGM, and also how they can use their own free platforms because they have high influence? How can they use their platforms to educate the community? Thank you so much.
Well, thank you so much, Shadia, for sharing those thoughts with us. Very important points that you raise. Unfortunately, we are at the end of this webinar, and I know that there are many questions. There are also so many things to think about, but what I would like to let you know is that I will share with you a one-pager with all the findings of my research so far. And also, since I have studied all the documents, so all the technical notes of UNICEF, UNFPA, but also all the other briefings, I will also list all of them with the links, the hyperlinks, so you can easily find them as well. So everybody has access to all the resources that are available at this very moment. And then in addition to that, Janet and I will also share useful links related to the mapping that we have discussed. I really would like to thank you also for, after the first webinar, I received so many positive responses. Also all your input. Every day I received an email from anywhere in the world, from Nigeria to Sierra Leone, to Kenya, to Tanzania. You were sharing your experiences, your knowledge, and I really appreciate that you did that. So thank you so much for doing that. I think we will continue with this webinar. So there might be another one in about 2 weeks from now. I'm thinking about maybe organizing it about FGM and COVID-19 in the Asian context, because I think we shouldn't overlook it. And there are also some very interesting developments going on there. So I would like to thank you very, very much. I don't know, Janet, is there anything you want to share or state before we say goodbye to everybody?
No, I don't think so, except we will also send the recording. So Steph is also talking about maybe doing something in French, which I think would be fantastic for French speakers. But I think that's probably better to have that as a separate event hosted by somebody who speaks French. So anyway, thank you everybody for joining again, and we will send out the information shortly.
Yeah, and thank you also to our speakers today. I'm sorry, Agnes, I don't know if you are online. I saw you were online, offline with the poor connection, but I will give you the opportunity another time to share with us your valuable points. Also, thanks a lot to COVAW. Thank you so much for sharing your insights with us. I really appreciate it. And thanks to all my friends who are out there who make this really work. So thank you so much. Have a good rest of the day.
Annemarie.
And we will keep in touch.
Yes.
Thank you.
Okay.
Bye-bye.
Bye. Bye.
Bye.